And welcome back to Talk of the Town. Dieesha Hicks has joined us for her monthly update. Today we're going to be talking about Medicare Part D. Dieesha is a State Health Insurance Assistance Program Manager with the Lowcountry Council of Governments. Dieesha, great to see you this February. Let's jump right into Medicare Part D.
Yes,
What
ma'am.
is it?
So Medicare Part D is a standalone Medicare prescription plan. It's not included in your original Medicare with your A and your Part B. It is standalone. There's no prescription coverage in original Medicare. So that drug plan is needed whether you find a standalone drug plan or you get it through a Medicare Advantage plan.
All right, so why is it important to have that Part D, the Medicare Part D for prescriptions?
It's important and it's very important to get it when you're supposed to get it because those penalties are for a lifetime. For instance, if you don't get it when you're initially turning 65 or when you stop working for an active employer, the penalty is 1% for every month that you have not had it times the national average, and it's added on to your Part D premiums, and it's a lifetime.
Oh, wow.
So say I'm 65 and I don't take any prescriptions, but then I'm 70 and I need this plan. I have all of those months of penalties to add to my Part D plan. So I tell a lot of people just get it when you're coming into initial enrollment. If you're not taking any any prescriptions, just get one that has a low cost just to prevent those penalties in the future.
Dieesha, would you think that a lot of folks don't know that there are penalties if you
They
don't
do
sign up?
not. They do not know about that Part D penalty. And it's kind of sad that they don't know because then you have a lot of people that are older in age or maybe veterans who are not on TRICARE for life, but they just get their prescriptions through the VA. And then now they're too old to kind of get to the VA, so they need one locally, but then they have all of those years of penalties, so it doesn't make any sense to even get it.
And you said the penalty will be tacked on to your Medicare premium.
Your Medicare Part D premium.
Okay.
So say you didn't have it for 7 months, so your penalty is around $3. Say you found a plan for $15, then they're going to add that $3 onto that plan for the rest of your life.
Okay. So when should you enroll? You mentioned earlier when you turn 65, when you go on Medicare, right?
Right. So when you're first coming into Medicare, again, you have the option of getting a standalone Medicare prescription plan, or you can get it through a Medicare Advantage plan. But you want to have that drug coverage in some capacity. You can also wait if you're still actively employed. You can wait until retirement to get that drug plan. Also, some people have COBRA insurance when they're between retiring and getting on their Medicare. COBRA is not equal to Medicare, but their drug plan is equal to the drug plan. So you won't get penalized if you have it within that COBRA. And I know that sounds like a lot of gibber jabber.
It's so confusing. That's why it's great to have you on the program to go through the ABCs.
Right. So when you're first coming in, just please just call somebody. Just try to make sure that you have everything that you need for Medicare to avoid those lifetime penalties, because the only way you could get out of that penalty is if you qualify for extra help. And extra help is through Social Security, where they help pay your drug premiums, your co-pays, your co-insurances, and your deductibles. That is the only way to get out of that penalty.
All right, and so I'm just going to ask you a very general question. When you turn 65, Dieesha, do you automatically have to go on Medicare?
The only people that don't have to go on Medicare without getting penalized are those who have active employee benefits. Like you have to be actively working. And not to add more confusion, but your employer has to have more than 20 employees, for you to keep your active employee benefits.
Right. Okay, very good. It is very complicated, and you do a nice job of explaining things for us. And if any of our viewers have questions, they can certainly go to the website at lowcountrycog.org. Thank you
Yes,
so
ma'am.
much, Dieesha Hicks. Thanks for being on our program.
Thank you for
this
having
month.
me.
And we'll see you next month, dear. And we'll be right back.